complaint of bloating since the past few weeks. Am I right?
Yeah, that's true.
Okay. So before we go ahead, can I ask a few questions so that I can understand more about your situation and we can reach a safe and mutually agreeable management plan? How does that sound?
That's fine.
Okay. Mrs. Smith, in your own words, can you tell me a bit more about your complaints? Since when has it started?
Yes, doctor, I've been actually very busy. I was just called in the middle of a meeting. I had some reports done because I was having some bloating sensation since the past
Mm-hmm.
2 months. Also, my
Mm-hmm.
periods have become scanty and irregular since the past 6 to 7 months.
Mm-hmm.
So I just was worried, and I had the doctor told me to get a scan done, and I'm here to know about the reports, doctor.
Okay. I'm really sorry that you're going through this. I understand it must be distressing, and I'll be definitely discussing your reports as well. But before that, can you tell me, are you having any loss of appetite?
No, just bloating and just feeling the tummy fullness all the time.
Okay. Any loss of weight?
No,
Any tummy pain?
no, doctor.
All right. And you also said that you're having your periods are scanty. So when was your last period?
It was about 2 months ago.
All right. And are you experiencing any swelling in your legs?
No,
Okay. Any difficulty in the waterworks?
no, nothing like that.
And any difficulty in the bowel movements?
No.
Okay. And before the 2 months, were your periods like before the 6 months? How were your periods? Were they regular then?
Yeah, previously they were regular, but since the past 6 to 7 months, they just have been very irregular.
Okay. Pardon me for being intrusive. I'll ask some questions which are a bit personal. Is that okay?
Yeah.
Okay. Mrs. Smith, are you sexually active?
My last relationship ended about 7 to 8 months ago, doctor.
Okay. All right. And do you have any history of any sexually shared infections in the past?
No.
Okay. And had you been using any birth control in the past?
Yeah, previously.
Okay. What was it?
I was on the pills.
Okay. And when did you stop?
It was a long time ago.
Okay. And are you experiencing any hot flashes?
Yeah, that has been quite a lot these days.
Any vaginal dryness?
Yeah.
And any loss of sexual desire as well?
Yeah, I don't have any sexual desires. This has been like almost 7 to 8 months.
Okay, I'm really sorry going through that. I'll definitely address that as well. And have you been up to date with your cervical screening? Hello?
Devani, are you there?
Yes, yes, I'm here.
Devani? I'll just stop the time. Devani? Network is like this. Devani, are you there?
Hello?
Yeah.
Yeah.
Have you been up to date with your cervical screening?
Yeah, the last one was about 1 year ago. It was normal.
All right. Any other medical condition of concern?
No,
Any surgery on your tummy or down below?
no.
Have you ever been pregnant?
No, I had no children.
Okay. And any family history of concern? Any history of cancer of the womb or the bowel, ovary?
No, not that I know of.
Okay. And are you aware of your weight to hydration?
Yeah, it's normal.
Okay. Are you aware of your blood group?
No,
Okay. Any restriction to blood transfusions?
no,
Okay. Any allergies?
no, doctor.
Pardon me for asking, do you smoke?
Occasionally, it's a very stressful job. So whenever I get stressed, I just resort to smoking.
Okay. How many cigarettes a day, if I may ask?
It's occasional, doctor, like 3 to 4 cigarettes a day.
Okay. Any alcohol?
Just on social gatherings.
Okay. Any recreational drugs? Pardon me for asking.
No, never.
Okay. And what do you work as?
I'm a CEO at a business firm.
All right. And how is the support at home?
I live alone.
Okay. And how have you been feeling the past few days?
I'm just very anxious about all this, doctor. This bloating, this irregular periods. I don't know what the scan says. Could you please just tell me about the reports?
Yes, definitely, Mrs. Smith. Before we go ahead, can I examine you in the presence of a chaperone and check your tummy and down below? Is that
Yeah,
okay?
okay.
And the nurse
Okay.
will take your blood pressure.
Yeah,
Okay.
that's fine.
Okay. So, Mrs. Smith, thank you for letting me examine you. And I see that you've come in alone. Would you like someone to be with you? Can I call my nurse to
No,
sit with you?
doctor, I'm just in a very hurry. I just had to leave my meeting and come. Please make it quick.
Okay, definitely. So, Mrs. Smith, I have your reports with me, and I've confirmed the name and NHS number. And I'm afraid it is a bit of a concerning news. What you can see is that in the ultrasound, I'll draw a diagram and show you. So, this is the womb, and on the right side, there is a large mass which has replaced the ovary. It is a large mass which has replaced the ovary, and there are certain abnormal areas in the mass as well.
What
So,
does this mean? Is it cancer, doctor?
Mrs. Smith, we cannot be very sure at the moment, but there can be a possibility, and we do need to keep this possibility at the back of our mind. You will need further evaluation. And also, I want to tell you that the blood test that we done, which tests the tumor markers or the certain proteins which are released by this mass in the blood, that is also raised, and it is significant. So, yes, there is a possibility of cancer that we do need to keep in mind.
So am I going to die?
Mrs. Smith, I'm really sorry that you're feeling this way, and I understand anyone in your place would feel the same. Definitely, we will try our best to manage you, and and we might need to undergo certain investigations before we completely ascertain the type of the cancer and the nature of the cancer. And I'll be definitely connecting with the support groups as well, as I know it is a stressful situation to be in. And if you allow me, may I go ahead and explain the management to you what we will do next?
Yes, please.
Yeah. So, Mrs. Smith, I'll be connecting you with my consultant, also the cancer doctor and the sleep doctor as well, and the Macmillan nurse and the specialist nurse as well. In based on your symptoms, we feel that there is a possibility of cancer. So you'll be needing to go a surgery, which we call as the staging laparotomy, which will involve a cut on your tummy in the midline, and then we will be assessing all the organs in the tummy.
I don't have time for all this, doctor. I'm in a hurry. I told you I left a meeting for this.
I definitely understand, Mrs. Smith. I know it is a difficult situation, but it is very important for your health that we do discuss this. Is it okay if I go ahead?
Okay.
Yeah, so we will be seeing the inside of your tummy. We'll be seeing the spread of the if any in your tummy, if any abnormality else is seen in your tummy, and we might need to do a complete surgery, which will involve removal of the womb and both the ovaries as well. Am I clear so far?
Okay.
And there's certain risks that come along with the surgery, that there can be a risk of a prolonged surgery, risk of blood clots, there can be chances of injury to the nearby structures, the bowel, the bladder, increased chances of bleeding, need for blood transfusion, need for a prolonged hospital stay and ICU admission as well. And there are also risks associated with the sleep medicine. And we'll also be assessing you for the risk of blood clots, and we might need to give you blood thinners as well. Am I clear so far?
Yes.
Yes. So, do you have any more questions for me?
So you'll be removing my ovaries also?
Yes. We will need to. We might need to remove both your ovaries because of the suspicion of cancer, and we'll be sending all this to the lab doctor who will be looking at it under the microscope, and then they will be giving us the report, and then we will be discussing it again. And if needed, you might also need certain cancer-killing medicines as well, which we call as the chemotherapy.
So will I be needing any hormone replacement therapy?
Time up.
Thank you.
Okay, thank you, Shivani, for presenting task. So Devyani, first I would like to take your opinion because you are already cleared MRCOG. So what's your opinion about our presentation? Then I'll give my feedback.
Yes, Shivani, a very good presentation. Your voice and your sympathy was very good with the patient. I just felt you could check the understanding a little more often. Like, am I clear so far? Is it clear so far? Any more questions? You just asked it in the end, so it could be a little more often. And if you could finish first, I could have asked the other questions which I had in my mind. So
Now,
if
what were
those,
those
there
questions,
are,
Devyani? What were those questions?
yeah, I was going to ask her about the HRT, as she said,
So,
and any
the
side
answer
effects.
for HRT, Shivani?
That we will be deciding with the menopausal doctor. Will be doing MDT for that as well, as she is having ovarian cancer.
So, what is the criteria for ovarian cancer when we offer HRT? Do we offer
Uh,
for ovarian cancer, or there are certain guideline or certain criteria of staging or grading?
I'm not sure about
Okay.
this.
Okay, we'll discuss this as well. Okay, very well done. Thank you, Devyani, to be there, and
Yes,
everyone
ma'am.
to be there throughout our feedback. So,
Yes, ma'am.
very well done. Very good job done, Shivani. For first, very importantly, clap, clap, clap that you have that courage to present in front of everyone just a month before exam, because that really needs courage. So, very well done for that. First thing. Now, let's start with introduction and setting agenda and everything. Introduction was perfect. Then setting agenda, you just immediately pick up that you have come for the Dr. Roser and Dr. Roser is not there, so that was also fine. That you apologize and then you ask or you taken a permission whether you can continue with that. That's very important because many students skip this line, but this is very important. This comes under patient communication. Then HOPI you started nicely. You ask about bowel symptoms. You ask about bladder symptom. The beautifully you ask about the other menopausal symptoms because she was saying that she was having scanty period. She's 46, she missed that period. So that is one thing which you missed in your telegram. That
Yes.
when she is giving some idea of her menopausal symptom or perimenopausal, you have to address at least one or two questions. One vasomotor you can ask and one anything related to sexual activity. My only suggestion is that whenever you're doing something like this, like as you ask about vaginal dryness, and she said that I am having dryness. Try
Mhm.
to address that question then and there. So
Okay.
there is high probability, probably in the second part of the task, you will not get chance or you may forget because this
Oh,
task is altogether for something different. So offer then and there that I can
okay.
offer you some vaginal cream or vaginal estrogen cream, which is safe. You can take as long as you want.
Okay.
Okay. Okay, then you ask about sexual activity, and nicely you didn't ask about urine pregnancy test because she's clearly saying that she is not sexually
Yeah.
active, and
Mm.
so there is no sense of asking whether any urine pregnancy test being conducted or not. So that's very intelligent. Uh,
Mm.
you ask about bloating, you ask about bowel, you ask about bladder, you ask about vasomotor, you ask about sexual history, you ask about any weight loss, but you didn't ask about poor appetite. These two questions.
I
No,
asked most.
you ask
Some.
one question. Either ask
Oh,
about weight or you have asked about appetite, but you didn't ask both. That this much I remember. So
okay.
always say in one go. Shivani, just
Okay.
to save your time and not missing. Of
Mhm.
late, are you noticing any change in appetite or loss of weight? One go, your job done. Clear?
Okay. Mhm.
This is. Uh, my only complaint for HOPI or information gathering is that it is clearly given, Shivani, that a large complex ovarian mass, right? Probably you would have asked, are you noticing that there is size, your waist size is increasing,
Mhm. Okay.
right? If she says yes, then what is going to be your next question? Whether it's rapidly or gradually. Because that
Gotcha.
is going to give you, though scan is pretty clear that what is going to be. But
Mhm.
again, if you ask that, you will show your examiner that you know how to differentiate between a benign and a malignant lesion.
Okay.
Understand? Basically, you have to show your examiner that when I see a patient, I know what are the relevant questions.
Mm.
So if you say something like that, it exam okay. Now she understands that we have to differentiate between benign and malignant. So what are the important questions? She asked about cancer questions. She also asked about whether it's increasing rapidly or slow.
Mhm.
Right?
Mhm.
And simultaneously, any pain in tummy that you ask nicely. So I have no problem with that. Other than that, I have no problem with HOPI. It is given that she is nulliparous. Whatever is
Yes.
given, never ask as a question.
Asking.
Always give her a suggestive question. So I can see that you have never been pregnant. Yes. Any
Hmm.
future plans? Yes, no, whatever she says.
Okay.
Cervical screening, you asked, there was some connection. Uh, Devani was having some problem with connection. So after that, it was any medical condition, surgical condition, you asked nicely. Any family history of concern. One concern again I had when you asked whom do you live with, she said alone. You moved on.
Okay.
She is not aware of her report, but you are very well aware of her report. You are going to discuss about cancer. She doesn't have any partner. She is staying alone. Don't you think that she needs some kind of support?
Mm.
So you see, it's not when we talk about support, it's not always financial.
Yeah.
Emotional support is equally important.
Okay.
Okay, so
Yes.
I'm staying alone. So do you want any kind of support? I can put you in touch with the support group or some social service.
Actually, I in MDT I said that I'll connect to support groups.
Make
Like in
sure,
the end.
Shivani,
Yes.
make sure,
Yes.
Shivani, certain
Hmm.
questions
Yes. Yes.
you are supposed to address then and there.
Mm-hmm.
Same if she asks, am I going to die? You'll not say, okay, wait, let me finish. Let me start with MDT. I'll answer your this question. Whatever question which you should address immediately, you should address immediately. Like support system. If somebody is emotionally feeling alone, not having any support, make a rule.
Mm-hmm.
Okay. Why? Probably you will get a tick in your support group checkbox. But if you are really
Yes.
targeting for global scoring, that you will
Mm.
only get if you address, it's not about saying anything. Shivani, it's
Okay.
about saying anything at the
At the
right
right
time.
time.
Yes, that's important. Now you got my point.
Yes.
Right? BMI, smoking, alcohol, blood group, Jehovah Witness, very, very important because eventually you are going to offer her a
Yes.
surgery which is high probability.
Mm.
Right? Examination, I'll quickly have a feel of your tummy because I want to check lump down below. If there is any change for her, atrophic changes, no?
Mm-hmm.
I'll just check if there is any change as per your age, any discharge, I'll make it swab. Nicely you have done BBN because she definitely needs BBN. Then you explain the report. Did you draw diagram? No. Shivani, do not think that suddenly on the day of exam it
Ma'am,
will.
she said, I'll help you with a diagram, she had said.
She said
I,
this.
s- I said, but I didn't draw like in when I was
Okay.
sitting here, so I
Even
didn't draw.
Shivani, whenever
Yes.
you are
Like
presenting any
practice.
task like online session in your courses,
Yes.
in your mock, start doing this.
Yes.
Because suddenly it will not come in your practice.
Mm-hmm.
No, and you have to make a beautiful diagram as well. So if it is in your practice, you are going to make quickly and a
Mm.
presentable diagram. So always do that.
Yes.
Okay.
Okay. Okay.
Then see what is CA 125, then coming to BBN. So you did that, you have some concern. What is the
Mm-hmm.
first step we are going to take if we have something like that?
Mm.
Yeah, yeah. It's okay, okay. Whatever is coming your way. What is the algorithm? Do you remember that algorithm?
Uh, can you repeat the question? I didn't understand. Like,
If we see this report, what is
yeah,
going to
okay.
be your very next step?
Yeah, I will calculate the RMI.
RMI. So how you are going to say about RMI? How you are going to mention it in a layman that she should understand what does it mean by RMI?
Okay. So Mrs. Smith, in our practice, we calculate a score which tells us the probability of the cancer.
Very good.
So in your case, it is more than 200. If it is more than 200, then there is a high chance that it could be a cancer. I'm really sorry to be the
What is
one
the
telling you this.
percentage of that risk?
I think
It's around 70%. So 7 out of 10 women with this report of your age having
will
the risk
have.
of ovarian cancer. Nicely.
Okay.
After that, then we have to offer her CT scan and MDT. Right?
Yes.
Then CT scan, after going through CT scan, all her RMI, all her history, MDT will go through and then decide whether there is high risk of having ovarian cancer or low risk for having ovarian cancer.
Mm.
Accordingly, we are going to offer the rest of surgery. You
Okay.
should have mentioned both the chart, both algorithms.
Okay.
Why? Because as of now, you are just calculating RMI, which is definitely much, much higher than 200. It's going to be obviously 800 is only CA 125. So it is going
Yes.
to be minimum,
7,000.
minimum more than, so it's anyhow more than 200, right?
Yes.
So how you have to proceed further? You will offer CT, you will offer MDT, then you will mention there is a risk of high risk of having this, there is low risk of having this. What you are going to do when it's low risk, what you are going to do then when it's high risk. Probably talking about complication, you can discuss when you have time. What is patient communication? See, if you do not give that both algorithm, that sub algorithm which is given, that algorithm right side, then two algorithm with subheadings. Patient communication, patient safety, and applied clinical knowledge, all going to get affected. Never see any domain separately. If you are not giving her a right treatment, not taking her through right treatment, or whatever the treatment or whatever diagnosis, possible diagnosis in your mind, you are affecting applied clinical knowledge. Why patient communication? Because patient communication says you have to give her diagnosis, you have to give her all the probability, you have to give her what all the available options for her. And why patient safety? She is already very snooty. I'm busy, I don't have time. Probably if you will not make her clear, she will not come again.
Okay,
So
yes.
you have to give complete algorithm. If you miss infection, bleeding, this and that, is not going to affect your mouth. But if you do not give that both algorithm, high likelihood, low likelihood, it is going to affect your three domains.
Yes.
Make it shorter, to the point. Part 3, you cannot tell stories because you don't have time. It's just telling touch, go, touch, go, touch, go. This is the formula. Because she has certain question, that is HRT. So how you have to address HRT? HRT, yeah. Tell me. Yeah.
In your case, when the ovaries are removed, the certain hormones that are produced by the ovaries will no longer be there, and they'll be affecting. It will have an effect on your heart, bone, as well as your mind. So we might need to give you extra hormones from outside to support it, and this will be discussed by the MDT team, and will also be referring you to the menopause clinic.
And it will depend upon the type of ovarian cancer. One line, because she was herself saying, are you going to, she is an educated woman. She's CEO. She knows what is HRT. She is herself asking, are you going to offer me HRT? It will depend upon your type of ovarian cancer if you have. And the cancer team and menopausal team will decide about it. But as of now, she is having many complaints. So rather than talking about infection and other things, you would have addressed this thing. At least you can offer her lifestyle changes, no?
Yes, I missed about smoking and alcohol also.
Yes.
Because I thought I'll talk about it later in the management, then I missed it.
Now you understood my point?
Yes.
Why you should know, if you have any fixed format in your mind, always follow that. If she says that I'm smoking, address then and there.
Okay.
Do not wait that I'll do this thing in second part of the task. Trust me on that. When you reach second part of the task, you are so much under pressure.
Yes.
You are so much under pressure, you tend to forget these small things which carry marks. Same like for vaginal dryness. You couldn't address this.
Yes.
But if you had addressed it, you would have got the marks. Now you got my point, Shivani?
Yes.
This is what I'm trying to say. So how you have to address HRT, you understood. For smoking, so at least some lifestyle changes. At least lifestyle. Probably you are going to perimenopause. There is decline in hormone, this and that, which may further increase. When we'll remove this, we call it as surgical menopause, and that is going to be more intense. Some lifestyle changes like eat healthy, drink healthy, quit smoking, alcohol, caffeine, sleep on time, some yoga, meditation, relaxing, and cognitive behavioral therapy. That's so very important.
Yes.
You can keep your room temperature cool. So even if you address this much with vaginal dryness, that's enough. If she asks for HRT, once we are done with all our investigation, definitely we'll discuss about HRT. She will never object about it. When she was very snooty, and this is real exam task, patient was very snooty. She was like, you're wasting my time. I've come from my meeting. Everybody is waiting for me. You address it nicely, but Shivani, you can like little bit more empathy, little bit more authority. So this point of time or any such statement, you have to make a balance between autonomy and her safety.
Yes.
So how you will say, Shivani? You'll say that, Arena, I really appreciate your commitment for your profession.
Yes.
But being healthcare professional, I'm equally committed for your safety.
Health, safety, yes.
I would suggest you to spare some time and get the test done.
Okay.
Understood?
Yes.
In the end, written information important, support group important, because you are mentioning something which could be a cancer. Always offer her support. Is somebody accompanying you? Do you want someone to be with you driving home back to your office?
Okay.
Something like that. Ending of your task has to be, you always remember climax of it. The climax has to be bullseye. Hitting a bullseye. It can be like this. If somebody is coming with some death in the family, or she's coming for, say, RRBSO because her friend died, and with very good note. Again, I'm sorry, Arena, that we are meeting in this situation. Rest assured, you are not alone. Job done. Okay? So that is all. So it's almost passed for me, but I'm not happy with your second parts. Second part of second part. The algorithm which you should have addressed nicely. So otherwise, it is almost passed. Take care of second part. Second part carries 3 domains.
Yes.
Did you mention MDT?
Yes.
Nice. So now quickly I'll show all the slides which I made. And this is just a glimpse how I'm going to take our sit back and relax. It is not going to be a complete task presentation like you are going to present 10 minutes task, because I understand just before 10 days or 12 days of exam, everybody is under pressure, which is totally understandable. It's very human having anxiety and not able to present or don't want to present. Totally understandable. So this course I have made that way. If you want to say some statement, if you want to give some statement like, okay, she doesn't want to get the test done, how you are going to address it? If you want to speak, it's fine. If you don't want to speak, I'll do it for you. Basically, you have to sit back, relax. I'll do revision for you. But if you want to actively participate, most welcome. What is important point, or what is the, I would say, salient point of this course? You are going to get slides of all 50 tasks. So you can revise these 50 tasks anytime after session within, I would say, half an hour or 1 hour. Okay? So let's start. Though I was not able to make information getting slide, because I just in the afternoon decided about this task, because most of the students were not able to understand how to present. Okay. So Devyani, I would like to have your active participation.
Yes, ma'am.
Turn your camera. Okay. This is your algorithm if RMI is more than 200. Shivani, can you see this? And
Yes,
this
ma'am.
is how you have to proceed further. So I have to share some concerning information. Do you want someone to be with you? No, doctor, what happened? After combining your history and specifically your tumor marker and the scan report, I have calculated RMI. RMI is an evidence-based calculation to assess probability of having ovarian cancer. And I'm afraid in your case is much higher than 200. It means a woman of your age with this ultrasound finding having risk 7 out of 10 for ovarian cancer. I'm sorry, I'm the bearer of this news. This is going to be, Shivani, your second warning shot. This is a difficult BBN. Difficult BBN is not going to complete without 2 warning shots. Right, Devyani? So now what we are going to do? We are going to offer you a spatial imaging technique. We call it as CT scan. And with that, we are going to refer you to expert team, that is cancer team. And going through your scan, your RMI, your history, they will decide what is the risk in your case of having ovarian cancer. Then you will talk about, Shivani, this, and then you will talk about this. Understood?
Yes,
So
ma'am.
if there is low risk, then you will be referred to a cancer unit of hospital. When a gynecology who is trained in oncology or cancer is going to offer you surgery, we call it as pelvic clearance. Whatever diagram you have drawn, in that particular diagram only you are going to explain that we are going to remove uterus, both tubes, ovaries. We will also take some sample from the lining of bowel and the collection of fluid also being sent for testing. But I'm afraid if there is high risk, then it is going to be a cancer hospital and a gynae cancer specialist going to assess you and going to perform surgery. We call it a staging laparotomy. It is going to be absolutely same as this, but there will be additional like removing the glands, and on the basis of this, that may be another surgery or some other treatment, probably giving you some drugs to kill cancer cells. These surgeries are normally performed by giving a midline cut from bikini line to navel. And whatever you are saying, Shivani, you have to draw simultaneously. If you draw, it decreases, it reduces the pressure of speaking.
Yes, ma'am.
If you draw, okay, this is navel. So if you see, you quickly make a navel, you quickly draw a bikini line or pubic hair line, and then we will give a cut from here till here, vertical. So whatever you're saying, you are drawing, she will understand, and your pressure of speaking will reduce. You will be able to finish your task on time.
Okay, ma'am.
Second, if it is less than 200, then it is low risk for malignancy. Then what are the true criteria? Asymptomatic, simple cyst, less than 3, between 3 to 5, because now we take it as more than 3. Unilocular, unilateral, conservative treatment, then repeat assessment in 4 to 6 months. And how we assess? With both CA125 and ultrasound. If it is resolved, then you will discharge your patient and you will give an individualized treatment. But persistent, unchanged, again, it is not deteriorating, right? It is not deteriorating. But if there is any change in the features, then you are going to take care of it. Then you are not going to discharge just like that. But if she is symptomatic, if it is more than 5, if multilocular, bilateral, we offer bilateral salpingo oophorectomy. Always remember, because sometimes they give 60 years old women, and mostly students get confused and they offer ovarian cystectomy. When she is postmenopausal, or if she is above 45, 46, she is giving some symptoms which are showing perimenopausal, definitely you can consider about this. Understood about this? Okay. Now, you should also be knowing this ultrasound report. That's very, very important, because at the time of, like during your exam, maybe under pressure, how to remember. So this slide is going to help you with that. What is simple cyst? When it is? Will you read Devyani this for me? You're muted, dear. Yeah.
Round or oval shape, thin or imperceptible wall, posterior acoustic enhancement, anechoic fluid, absence of septations or nodules.
When it is complex cyst?
Complete septation, that is multilocular cyst, solid nodules, and papillary projections.
So first difference you should be knowing between simple cyst and complex ovarian cyst. The first difference. What is second difference you should be knowing? If it is a complex cyst, it can be benign, it can be embryo. So what is first difference between simple and complex ovarian cyst? And when it is complex ovarian cyst, it can be benign, it can be malignant. Am I clear about this, everyone? Everyone
Yes,
is
ma'am.
clear about this? Very good. So first remember this slide, and then complex is benign and embryo. How we calculate CA125? Because at times this may come like junior wants to understand. So this is ultrasound, this is menopause, this is CA125, CA125 actual value, perimenopausal, it's 1, or premenopausal is 1. When it's postmenopausal, it's 3. And when patient is having 5 features, like no features, it's 0. 1 is 2. If it is 2 or more, then it's 3. So no feature 0, 1 feature. If patient is having even 1 feature, it is not going to be 0. Right? It is not going to be 0. So even if it is perimenopause, it is 1. It is 800. It is 1. What is RMI? 800. Okay. So always remember RMI. I have seen a student, they get confused between 40 to 45. Because less than 40 is obviously perimenopausal. 45 onwards having some perimenopausal symptom, okay, it's easy to justify, okay, it's postmenopausal. What to do between 41 to 45? Between 41 to 45, first ask all your menopausal symptoms very carefully. Very carefully. If she is having any such symptoms, probably she is approaching perimenopause. Though average age is 51, but somebody can have menopause or attain menopause at 40 to 43. If she is not giving any perimenopausal symptoms, then you will decide only on the basis of your this criteria. If it is showing complex cyst, kindly follow this OETA ruling for ultrasound. Understood, everybody? If she is having menopausal symptom before 45, Shivani, only then we offer any blood test. Okay? You mention in your task that we'll offer you FSH. Probably that is not applicable because she is already 46. These are small points. There is no negative marking in part 3. But if you talk about global scoring, examiner will definitely think, which means he doesn't know when we offer this test.
Yes.
Or probably if they might have written something, if somebody is offering FSH, then take a note of it. Or FSH not to be offered.
Yes.
If they have given this line in their checkbox, you are going to get a cross. My suggestion for part 3, Devyani, I think you will agree with that. Touch, go. Shivani, whatever I have mentioned about this surgery detail, did I explain everything like too enlarged picture of like you have to do this way, you have to do surgery this way, or it was just touch and go what surgery we are going to offer and what extra we are going to do here?
Yeah.
If you get time after that, if you finish whatever is important, if you have time, then you speak whatever you want to speak. Because here, second point is HRT.
Yes.
Second point is perimenopausal symptom, which is bothering her because she is a CEO. She needs to attend many meetings and it is bothering her. So basically two agenda. One main agenda is definitely giving her treatment plan for ovarian cyst, but secondary agenda, which probably not main, but you cannot ignore that, offering her some assurance, some treatment, probably lifestyle only, probably CBT only, for menopause.
Yes.
Understood?
Yes.
So tell me, Devyani, to give her global scoring, would you like to see this doctor again?
Yeah.
Okay. So Shivani, you got that point. Because this is one question examiner normally asks to role player once you leave chamber, that are you going to see this doctor again? And that is completely based on how you treated her. Treated means not writing anything. Treated means answering her queries.
Okay.
If she's saying vaginal dryness, address then and there. If she's saying I'm alone, address then and there. If she's smoking, address then and there. If she's interrupting you, so what do you want to say? I'm having cancer. Address then and there, very calm. Very calm. I totally understand your concern, Arena. As of now, it is showing that risk is in 7 out of 10 women. we need to offer certain other tests and the expert team evaluation to confirm what is the risk you are having for ovarian cancer.
Mm.
Am I going to die? Did you ask this question, Devyani?
Yeah.
Okay, so now Devyani is saying, am I going to die? How you are going to address that? Take your time, take 30 seconds, think properly, and just answer in 2 lines, not more than that.
Okay. I understand that you're feeling overwhelmed by this news, and anyone in your place would feel the same.
Difficult to comment as of now.
Yeah. Okay.
And when will come to know?
And
After proper evaluation, I would be able to answer your question.
okay.
So how you are going to address that?
At least what?
Same question. Am I going to die?
Okay. I understand that anyone in your situation will feel overwhelmed, and I'm really sorry that you're feeling that way. And
Difficult to comment as of now.
yeah, it is difficult to comment as of now, but we'll be definitely doing some more evaluation, which might help us understand the situation better.
Understood?
Yes.
Your answer would be as per question.
Yes.
There is not a fixed answer for every question.
Yes.
You have to have that presence of mind. As per her question, your answer should be there. And by any chance, if you are not able to make any answer, take 10 seconds.
Okay.
Rather than started speaking then and there, and you started speaking, and now you're making your sentence, and which you can finish in 1 or 2 lines. Now you're taking how many lines? 5, 6
5,
lines. So
6
you're
lines.
speaking
Yes.
and simultaneously you're making, speaking, making. So start your answer. Take your 10 seconds. 10 seconds are not going to affect your oval or timing. Trust me on that. Because eventually you will be able to address that question in 2 or 3 lines. But you start speaking without thinking, probably 6 lines, 7 lines. And probably won't be satisfied even after that. And always check, are you with me? Am I clear so far? Do you want me to repeat anything? Okay. And always take patient name in between. So Arena, are you with me? Arena, are you getting me? Arena, am I clear so far? If you take somebody's name, it shows that you are giving importance to them. If I call you, okay, doctor, okay, student, would you like it? But if I'm continuously mentioning your name because you have presented tasks that Shivani will do this way, Shivani will do this way, won't you like it better?
Yes.
As simple as. Okay. So I really wanted to do tasks for this because I don't know, there's some confusion about algorithm. So this is the algorithm which you have to follow. Remember that.
Okay.
And never forget whatever secondary minor agenda that also carries marks. So this is how we are going to have all these slides in our the sit back, relax, and revision. We are going to get all these slides, so you can literally sit back, relax, and I'm going to recite. If you want to do any presentation, any statement, how you want to address, if I'm going to die, how you want to address, whether she's saying that, oh, I'm busy, I'm this thing, you can definitely address in that session. But there won't be any compulsion that you have to speak, because on that particular day, I don't want to give any pressure to anyone, because my purpose is just to make you help in revising 50 very important, new, and difficult tasks. That's all for today. Good night. Take care. Bye-bye. I made a WhatsApp group specifically only for May students who are appearing in exam. So that will be very focused preparation. Devyani, you have to take care of that group. You need to post tasks on regular basis, and I'll be ready with my feedback.
Actually, I was in the group, but I got removed somehow. I don't know.
No, that was the other group. That is a common group. We have specifically made that group today itself. Because there was too much of information in Telegram, so somehow we are missing our task and you are not able to see your feedbacks. Right. And I'm literally want to work with May student, because as of now, obviously they are the priority.
Yes, ma'am, will you be sharing the link?
Yeah, Devyani, please add her. You're also added. Yeah. Okay. Thank you, Devyani. Thank you, Shivani. Thank you, Prati. Thank you. Let me thank you, everyone. Sharda and Tang and Samira. Sorbi, thank you so much. Sally, thank you. Sadia, Neelam, Shweta, Sara, thank you so much for attending. Keep studying. One last suggestion. One last suggestion. Stop looking here and there. Stop looking what your study partner is doing. This is your own time. Whatever you do now, that is going to affect your exam. Do not stop looking here, there in different groups, what they are doing, what you have done, you have done. Now this is the time to revise. If you are not able to revise, you won't be able to deliver on that day.
Yes.
So your preparation, all your hard work which you have done for 6 months, this is the time to revise all those tasks. Clear? One formula, touch, go, touch, go. That's it. Unless patient asks, can you tell me more about staging laparotomy? It means what is agenda there in Devyani? That task? Staging
Stages.
laparotomy. So now you are clear. Okay, she wants to understand about the staging laparotomy. There are many questions there. Okay. Okay, thank you. Link for the group. Okay. Everybody who wants to join that WhatsApp group, please contact Devyani. Devyani, they'll DM you. Just ask as a protocol for their exam ticket booking, right? Because I want to keep it exclusively only for May students.
Okay. Yeah.
Okay. That's all for today. Good night. Take care. Bye-bye. Sayonara.
Thank you, ma'am. Thank you.
Hello.
Bye, ma'am.
Bye.
Thank you.